If we have sex or intercourse and the woman reach orgasm, can that bring contractions? A lot of people that might have had miscarriages might think that, oh, because I'm having sex. No, that's not true.
I want more sex. Some women don't want sex in pregnancy. They feel irritated. They feel like the husband is bothering them. But I always advise this kind of women, allow daddy to have his way. Allow him to have fun. Allow him to have the bond. In the process, he might turn you on.
I'll ask myself the first question, which is sex safe in pregnancy? So the answer to that is that absolutely, sex is very safe. And for different reasons, I think we usually encourage people to continue to have sex. I mean, the most important thing about pregnancy is usually a sign of a loving relationship. I think I underline usually. And when somebody is pregnant, it's very important for that loving relationship to continue. In terms of bonding with the pregnant person, also in terms of being involved with the baby as well. I think a lot of people are scared. They're scared because they feel that intercourse can affect the baby or can hurt the baby in any way. So that's not true. So because I think if you remember, the baby is in a container. So the first container is the womb itself. The second container is the amniotic sac. Third thing is the fluid around the baby. So before any contact can get to the baby, it has to go through all that. So there are like cushion effect of all those before impact can reach the baby. It's absolutely safe to have sex in pregnancy, but the question is that, do people have the libido, or they have the interest to want to have? I think somebody already asked that question. Well, there's a lot of hormonal surge in pregnancy, and there's a lot of physical changes as well. And some people that affects some people. They see themselves slightly differently. Some hormones can change how you think. But it can go both ways. Some people are actually they have extremely high libido during pregnancy, and some people have low libido. So we're very different how we react. Sometimes it might be that the woman just doesn't like the sex because their body is swollen, the vagina is a bit swollen, sex hurts them. So in a situation like that, you might want to encourage your partner to use lubricants and things like that. So lubrication to make the penetration less painful. So my take on that is that I think we just need to work on each other, talk about it, and find a way to, which is not any different from when you're not in. Sometimes even people that are not pregnant have low libido for different reasons. It might be stress from work, it might be stress from anything, it might be financial stress. Pregnancy sometimes have a bit of stress impact on some people. So I believe that with that, but it's all about communications and stuff like that. So a lot of people think about, oh, can sex cause miscarriages? So the answer to that as well is that sex cannot cause miscarriage. It does not cause miscarriage. But it's also important to work with your doctor when you are asking these questions, because some people might have challenges. Maybe, for example, some people have something called incompetent cervix. That means their cervix is a bit weak and stuff like that. And in situation like that, yes, you might want to advise a patient to stay off sex. The second thing is that in some people where the water around the baby, or they've been leaking water, and so the baby is exposed, you have to think about that and discuss that with your doctor as well, because what you don't want to do is introduce sex infection from the vagina into the womb. So I think with that, there are some definitely contraindications to having sex. Or for example, you have something called a low-lying placenta, where maybe the person has been bleeding and they found out that the placenta is actually covering the cervix. So you might be advised not to have sex in a situation like that, because if you do, you can trigger bleeding. So apart from that, it's absolutely safe to have sex in pregnancy. So some other people will ask the question that, okay, so if it's safe in pregnancy, what position is normal? Sex is just like every other, whether you're pregnant or not, every position it can be done. The only thing is that some of them you have to be careful. For example, the missionary position where a husband is lying on his wife. If that is going to be done, it's important that the weight of the husband is not put on the tummy of the wife, obviously for obvious reasons. But missionary can still be done, just ensuring that the weight is not put on that. Every other position is fine. It does not, the risk of causing any problem is not significant in any other positions at all. Also, some people worry that, okay, you know what, if we have sex or intercourse and the woman reach orgasm, can that bring contractions? The answer to that is no, it doesn't. Yes, and when a woman has orgasm, some of the uterus, the womb, can have mild contractions, but these are not contractions that can put a woman into labor. Some people actually believe that those contractions are beneficial because it makes the womb start getting ready somehow, and it increases the pain threshold for a woman. I mean, that's theoretical. I'm not sure how true that is. So that when a woman is actually in labor, they can withstand the pain a bit more. Like I said, I don't think that's research-based, but it's an information that's out there. Okay, the other question a lot of people ask that, okay, but why do they tell us that if we have sex towards labor, that it can cause you to go into labor quickly? Yes, we tell patients that. The reason we say that is that there's in the later part of pregnancy, your body is trying to get ready, and then your womb has something called some receptors. Now, the sperm has a component called prostaglandin, and this prostaglandin sometimes can go to the prostaglandin is one of the things they use for inducing labor. But in the sperm, you don't have a lot, or you don't have enough, and so it's not something that, I mean, what we believe is that if you do it a bit more frequently, tiny little amounts of it in the third trimester after 37 weeks sometimes helps. It's not like it's proven that it does, but we think that it does have some impact. But we've not seen somebody that says, oh, I had sex and I went into labor just like that. It's not something that usually happens. Can I get pregnant? I'm not going to go into that because that's a bit complicated. Some people read some things and say that, yeah, I read somewhere that a woman can get pregnant twice in the same pregnancy. Yes, it can happen, but extremely rare situation, extremely rare, where one child will be older than the other. You know, it's very rare. So I will not go into that. That's not a common occurrence. The mood of the people that are involved. Now, we all know that pregnancy or sex is related to, has some kind of mood association. It depends on you. That's why you hear a lot of women say, or couples say, oh, when I'm not in the mood, I have a headache, XYZ. Yes, mood do change in pregnancy, but it depends. Like I said, it's not constant. Some people are very, their libido is extremely high when they're pregnant because of the blood supply to their external vagina area, which increases the sensitivity there. Some people, their mood is just, pregnancy makes them, it's just not something they want to think about. So sometimes it depends on whether the husband understands that or not, but those are things that can be worked on. Now, let's look at the first trimester. A lot of people, I just saw a question now, can you have sex in the first trimester? Absolutely, you can have sex in any trimester. It's not contraindicated at all. So, but you have to look at individual stories. The first thing is that a A lot of people that might have had miscarriages might think that, oh, because I'm having sex. No, that's not true. Sex has no implication with miscarriages at all. So it's not related to miscarriage in any way. So you can do, miscarriage is usually due to something wrong with the womb or something wrong with the pregnancy itself. A lot of pregnancy are not normally formed, so they lead to miscarriages. Second trimester, absolutely, you can have sex in second trimester, and third trimester, you can definitely have sex. But it's also important not to feel that you're abnormal if you don't have any sexual drive when you're pregnant. Because you're pregnant and you gain, or women gain weight, sometimes that affects them in terms of their perception or how they feel about themselves and stuff like that. They don't feel attractive enough to want to expose themselves and stuff like that. So, and because of that, they're not in the mood to want to have sex. Or are lubricant safe? Yes, the water-based or the water-based lubricants are very safe. Like the Durex one. If you go to very good pharmacists, there are a lot of good ones that are just purely water-based. They don't have any medicinal component at all. I think you can use that. I'm not judging anybody. I'm just saying that when you have had a baby, and especially you've had either a vaginal delivery or you've had a CS, things can be a bit painful down there. So you just have to work with your husband, work with your partner to understand that. But also important that there's no reason to be waiting for about 6 months in a sexually active relationship before pregnancy, during pregnancy, and waiting, you know. Sometimes all that creates sometimes unnecessary tension. So it's important that one of the things that you must have to do though is talk about these things. So if you're sore, then you have to find a way, or the husband needs to wait for the soreness and everything to go down before start trying again. Things sometimes takes a bit longer. People are extremely different in terms of how they heal after they've had bruises here, bruises there. I think it's just waiting for that time and maybe gently introducing sex back. So I will employ, or I will advise the partners to be, I won't say sympathetic, I won't use sympathy, I'll just say to be a partner at that time. I think one of the things I find really important is the communication part. Just communicating with the woman, understanding what she's going through, understanding it, and not to rush her that much, but also from the woman point, understanding that there's nothing saying that your body should have gone back to normal after 6 weeks. So ideally, most people should be able to have sex after 6 weeks. But it's also important that, like I said, everybody is different. Some people have not completely healed. You just have to work with your body. But I think 6 months is definitely too long. Some people are worried about, oh, am I going to go back to my normal size after having this big baby? A lot of people do actually, but that is based on skin type. The body is very contractile. It contracts back to its original position. So I don't think that should be an issue. And if you feel that you have a body type that's very lax, maybe introduce the Kegel mechanism very early. And I'm sure a lot of people know about Kegel, which is like strengthening your perineal muscle. The way to describe that is that you just seem as if you want to go to the toilet, but you're preventing so you want to move so assuming you want to go and move your bowel, and it's about to come, and then you're stopping it. And you do that so many times in the day. So what it does is that even when you're pregnant, you can do that because it's strengthening the muscle there. Okay. What of using coconut oil as a lubricant? Well, I don't have any experience with that. I want to believe that if it's pure coconut oil, why not? If it's scented, as in other things are added to it, then I will advise you to avoid it. So because, you know, obviously that can cause changes there and cause some discharge and stuff like that, some funny smelling discharge. What about silicone-based lubricant? Well, I would not advise you to use anything silicone-based lubricant. I think that what I would advise is just pure water-based lubricants. That's all. Nothing more than that.
So sex during pregnancy, actually, whether penetrative or otherwise, it can increase a sense of love. This is where some people think in their head, once I'm pregnant, I have to run away from my wife because she's already full. What does she want? What more does she want? No, we need to maintain intimacy. We need to still come together, caressing, kissing. It makes it stronger and it alleviates a lot of anxiety. Sharing and all that between partners, love and affection, very important. We cannot I don't think we can put that aside. All things work together. Many women find that they have increased sexual desire. If I use myself as an example, I love sex in pregnancy. And I kid you not, it's probably because of, as Dr. Alabi mentioned, because of the influx and inflow of blood to the vagina. It makes it very sensitive and very, it feels good. I just notice when I'm pregnant, I want more sex. Some women don't want sex in pregnancy. They feel irritated. They feel like the husband is bothering them. But I always advise this kind of women, allow daddy to get it out of his way. Allow him to have fun. Allow him to have the bond. In the process, he might turn you on. That's what I tell them. I have a decreased libido. I cannot have sex. And I usually tell them, allow your husband to start. You will get there. Because what happens is the same hormones that control pregnancy control sex. So if your husband knows how to work it right, you will bring her to the right point where she wants to be. Then you can turn her on, touching her at the right places. Some men find the changing of the wife's body to be more, attractive because the breast is fuller. Some faces are rounder. So women are beautiful in pregnancy. Unlike me, you will never catch me pregnant. That I can tell you. I'm done with babies because I don't look like myself when I'm pregnant. But I still keep my makeup on. I make sure I'm, even in pregnancy, I do more makeup because I don't want my nose to be prominent. I don't want my lips to be so thick. So there are some things you still have to do as a woman to make yourself attractive. Pregnancy is not a disease. Okay, if you want to say it's a disease, but it's a good disease. So I always like women to maintain their posture. If you didn't wear makeup before, I didn't say you should wear makeup, but if you wear makeup, continue. The days you feel like it, just make up. Whether your husband is home, whenever he comes back home, definitely he will see the makeup on you. So keep yourself attractive, keep yourself beautiful in pregnancy. It is not a disease. I know we may be sick. The first trimester may be really wacko, like everybody's sick, we are throwing up, we're vomiting. I don't even feel like doing anything, or I'm tired. That is understandable. But once you pick yourself back up, you need to actually look beautiful. Look beautiful. Look nice. Be attractive. But there are some reasons why you may ask to abstain from sex. Some women have incompetent uterus whereby cyclage has been done. Doctor may say you don't have sex. Premature or preterm labor. Doctor may say you should not have sex. Placenta previa, like doctor mentioned, when your cervix, when your placenta is covered, you may not have sex. Reoccurring miscarriages, you may ask not to have sex. Leaking amniotic fluid, that means you're always leaking fluid every now and then. You may also ask not to have sex. Sometimes even with unexplained, vagina bleeding or discharge. If any reason you are asked not to have sex, you can still do other stuff. You can touchy, you can kissy, you can do all kinds of stuff. You know, abstaining from penetration does not mean abstaining from intimacy. I hope you are clear. Benefits. They say it helps you sleep better, lower blood pressures, it makes you happy, just to mention a few. Then we have problems. As we have benefits, there's pros and there's cons. Cramping. This is normal after sex, especially when you have orgasm. And that's due to the blood flow to the area of the pelvic, and also we have some kind of oxytocin released at that time. Allow yourself to get over it. Just relax in bed. The cramping would go away. Bleeding, spotting, and bleeding after intercourse while pregnant usually is nothing to worry about. But if it's copious amount, you may have to come to the hospital because it can also be a sign of underlying problems. But if you just spot or just a little bit, it may not be something to worry about. Amniotic fluid leakage, please report to the hospital immediately. After sex and you're leaking fluid, please let us know. Myth. I have some myth about sex in pregnancy. Having sex can hurt the baby. No, it is not so. Having sex in the afternoon, you can have albino. That's the albino children. That is not true. Sex can be at any time. Having sex helps the baby through the passage to have, it helps the baby to come out. And when I say that, I always say it in class. Just look at the head of a penis and look at the head of a baby. What is the correlation? It's really not the passage. So it's not true. But sex can increase oxytocin production, and it can actually help in the third trimester, especially in your last, particular EDD week. Okay? I always say this joke too. When I go to the hospital, when I have my children checking in for delivery, and they will do a quick checklist. Your last menstrual period, and they're gonna ask me, when was your last sex? And I'll tell them, this morning. And the lady looks at me, you're nasty. It's good. I always give my husband the last one for the road, because in the next 2-3 weeks, 4 weeks, even 6 weeks, if CS, you may not be able to have sex. So load him up, give him something to run with, and that is very advisable. So his baby is coming out anyway, so let's do it. There are several positions for sex, which I'm going to actually go one by one. I have classic missionary. This is advisable first and second trimester. Classic missionary, first and second trimester. Modified missionary, first and second trimester. Possibly the third. That is if you are not too heavy, because some people are actually very big. If you are like me, I'm very huge when I'm pregnant. You would think I'm having a baby elephant. Very huge. And then my babies are very big. So that explains my belly. So in that kind of case, you may not be able to do a modified missionary. But if you're the itty bitty belly, you can go ahead and do it. And this one I call wheelbarrow. As all of you can see, I've created the names for them. And some I picked off of line. Wheelbarrow is good first and second trimester. And I always tell pregnant women, do it now. So let's see how it is when you can no longer be on top of me. That's what I tell people. Because yes, you can be on top, it's okay. But most times when men are on top, when they want to have orgasm, they start speaking Spanish or they start speaking German, and they lose control and they can fall right on top of you. So when it gets to the speaking, because my husband likes to be on top, so I say, when he starts to speak the language, from another world, I'm ready to push him off. If you're that kind of woman, you can actually push him off. But if you can't, it's dangerous to be on top when your bum is already showing. This is spooning. This is when you just lie down there and your husband does the work. and you're enjoying it. So for those of us that are saying, ooh, I don't feel like having sex, let him see this style. So show your husbands. The spooning, husband goes for it, he finds the hole, he penetrates, you are just lying down there. And of course you need some pillows to raise your legs up, so that way he can get the right hole. He does not go into the wrong hole. So he's the one doing all the work. It's okay, you just lie down there. So this is good for when you don't have the drive, but daddy needs to get his groove on. Daddy needs to, keep things going. I hate when women are pregnant and they're having their husbands go out to mistresses. It is not advisable. You are the owner of your husband. Nobody else can have him. So satisfy him. And I'm speaking to husbands right now. The days she doesn't want it, please understand. And this is for the moms. Not wanting it should not be every day. So let's compromise. Moving on, baby on top. That's what I call this. So if the baby is a baby, however you want to interpret the baby, it could be your wife, it could be the baby, but I know baby is on top. If you can do this, it's good for all trimester. So moving on, they call it the doggy style, very popular. Even when you're not pregnant, it's a good style. But if you can, please support as much as possible. Support your body with a lot of pillows. Support your belly, because when we get to the German, the Spanish speaking moment, so you don't hit your bum on the bed. So give extra cushion. This is scissors. It's good for first and second trimester. Scissors is quite, even sometimes second trimester may not be possible because you're coming to the front. You are actually doing like supposedly, you're on top of each other, but you flipped it. So you're actually going to be very close. So if the baby bump is too big, this might not be good after first trimester. Okay? So, and I'm going to call this stand up for the champion. So this is also a good style if you want to do that. So I named this stand up for the champion. Both of you are standing and you're supporting yourself. And I want to tell you, pregnancy is a good thing. Sex is a good thing. That's why you got pregnant. So enjoy sex in pregnancy.